Our healthcare systems have faced real challenges this year, including and maybe especially emergency rooms being closed due to low staffing levels. There was also staff burnout and a shortage of primary care physicians. Dr. Joss Reimer joins us from Vancouver to look at the challenges and some of the highlights from this year. Dr. Reimer is the president of the Canadian Medical Association. Great to speak with you. Good morning.
Well, thanks so much for having me.
All right, let's start with the biggest issue facing Canadian healthcare right now. What would you say it is?
Oh, without a question, it remains access to healthcare. We're hearing from Canadians from coast to coast to coast that, above all, access to primary care seems to be the #1 concern. But there's no doubt that emergency room closures is right up there as well. And same with waiting to get surgery, waiting to get diagnostic tests. You know, you mentioned at the start that there's been emergency room closures, and one of the big concerns we have is that we don't even know how many there have been. We saw a CBC report on Ontario showing the numbers there, but we don't know for any other province and territory, and certainly we don't want to be depending on the media to be tracking those types of numbers. So access seems to be our #1 issue across the country.
Yeah, definitely. I mean, I know that anecdotally, but I hear it from doctors as well. You've said the creation of Health Workforce Canada is a success in our healthcare system this year. Describe what it is in case people aren't familiar with it and what difference it's made.
Well, absolutely. So at the national level, we've never really had anyone who was dedicated to workforce planning within the health system. So we had different provinces, territories, even smaller jurisdictions, or sometimes specific health provider types where we did some planning, but we've never had anyone that tried to take a look at the whole health system to see where do we need more doctors, more nurses, more respiratory therapists, and how do we get them? What are the numbers like? So having a national body that's aimed at looking at that type of planning is really critical so that we know where to put the investment. Right now, we're trying to increase class sizes. We're trying to build teams at the primary care level, but we don't have enough information about where those resources need to be. And when we're doing that long-term planning, that's critical. So we're looking forward to seeing what comes out of Health Workforce Canada over the next couple of years.
Emergency rooms, let's talk about that. We know they have been pushed past their breaking point. They really become this delta, this depository for everything that's wrong with the system. What's the reality of emergency care rooms right across the country? You talked about Ontario, but I can tell you on this show, we've talked to several health boards in Atlantic Canada, and it is dire there as well.
I completely agree. Across the country, we're hearing about challenges in emergency rooms. And part of it is the emergency rooms itself, but the challenges go far beyond the emergency room. And yet that's where we see these symptoms of the issue. Because when people don't have access to primary care, they do two things. One is they go to the emergency rooms to get their primary care. And the other is their health conditions that could have been managed at the primary care level become more complicated when they don't get that care that they need. And then they do need a higher level of care. So they go to the emergency room. And then you combine that with the staffing challenges that we're having, particularly in rural areas, and that's where you see those closures happening. And that's the last thing we want. When someone's having a heart attack in a rural area, they need to know where they can go for help, because that small amount of time trying to figure that out can cost them some long-term health effects. So this is something that's leading to problems for Canadians and burnout for healthcare providers. It's a real challenge we need to be investing in.
When the system started to sort of implode in and of itself, we started to look outside of the system. Let's talk about privatization and the role it now plays in healthcare in Canada.
Well, we've had private care in Canada for a long time. When you think about pharmacies or even most physician offices, labs, these are all privately run services, but most of them are publicly funded. What we're seeing now is governments looking at some alternative private options to fill gaps, like private surgical centers, or we're even seeing some privately paid primary care options. And that's where we have some concerns, because when we did a review of the medical literature, we also talked to 10,000 Canadians this year and looked at other countries. We really saw that when we look at private versus publicly funded and publicly versus privately delivered care, in general, privately delivered care was more expensive with poor health outcomes. Now, again, that doesn't mean we get rid of all private care. There's lots of it that's well embedded in the system. But it does mean we should be really cautious if we're looking at it as an answer, because we don't want a private surgical center to be having more expensive and worse outcomes for Canadians and be pulling healthcare workers out of the public system to staff it. Because I know in several provinces right now, we have operating rooms in the public system that are closed because we can't staff staff them. We simply don't have the nurses, the anesthetists to keep them open. And yet if we're trying to put in private services, we're going to be pulling even more staff members to staff the private ORs at the cost of the public system. So this is something we need to be very cautious about, and making sure that we're evaluating all of our options and looking at how these different options are going to impact the system as a whole.
I know the challenge every year is trying to fix it while you're still operating in it at the same time. Canadian Medical Association President Dr. Joss Reimer, great to speak to you at the end of 2024. Looking forward to 2025 and some of the solutions that you highlighted.
Yeah, there's a lot of really great options that are coming in the future. And so we're really excited to see some of the team-based care that we've seen in a few different provinces, as well as looking at the increases in class sizes, Health Workforce Canada. So despite all the challenges we just talked about, I am excited for the future. I think we're moving in a good direction.
All right. Thanks so much. Happy holidays to you.
Thank you. You as well.
If you liked that video, make sure to subscribe to the Your Morning YouTube feed, where you can find all kinds of new content posted every weekday morning.